than 160 years, St. Vincent's Hospital stood as a cornerstone of healthcare in New York City, even earning a reputation for treating anyone who walked through its doors, regardless of income, background, or faith. Founded in 1849 in the aftermath of a deadly cholera epidemic, the hospital became a pioneer in medicine while responding to some of the city's darkest moments. A newly published book tells the remarkable story of the Sisters of Charity, whose faith and dedication helped shape one of New York's most important Catholic hospitals and left a lasting mark on American healthcare. Joining us now is Dr. Thomas Rzeznik, professor of history at Seton Hall University, a historian of American Catholicism, and author of A Monument of Charity, St. Vincent's Hospital and Catholic Healthcare in New York City. Dr. Rzeznik, thank you so much for joining us.
It's my pleasure. Thank you for having me.
Your book tells the story of the Sisters of Charity and St. Vincent's Hospital, founded in Manhattan. What inspired you to dive into this topic, and why do you think it's so important today?
Yeah, I was inspired to take up the history of St. Vincent's Hospital in 2010 when news of the hospital's closure made local headlines. And when I started looking into the history of the hospital, I realized there was such a rich story that needed to be told. Here was a hospital that had served the people of New York for more than 160 years. And it captures not just kind of the story of healthcare in New York City, but really the contributions of Catholic sisters to healthcare in the United States.
Now, this was unprecedented with Catholic sisters making such an impact. What made their approach to caring for the sick and the poor so distinctive?
Yeah, when St. Vincent's Hospital opened in 1849, it began with a simple but radical mission to accept all in need, regardless of their ability to pay. They were devoted to caring for the poor, and they made it clear that St. Vincent's would not discriminate against those who could not pay. That was a really radical stance at the time when healthcare was often considered a private good for those who could afford it. And the Sisters of Charity wanted to live out their mission of charity and extend healthcare to all.
For more than 160 years, St. Vincent's was at the heart of the Manhattan community. What role did it play in the lives of generations of New Yorkers?
St. Vincent's was really a New York City institution through and through. It was located in Greenwich Village. It started off in a really humble fashion with 30 beds and 4 sisters and not much more. And eventually it grew to become the largest Catholic hospital in the United States, the largest hospital of any religious denomination in the United States. And it really had a mission to serve not just Catholics, but the entire community. Its doors were always open, and that was evidenced through and through, from caring for the famine Irish who arrived and other immigrants who came to New York City in the mid-1800s, all the way through to being there through the AIDS crisis and in responding to the attacks of 9/11.
One of the hallmarks of St. Vincent's was its commitment to palliative care. Why was helping the seriously ill such an important part of this mission?
This was part of what Catholic sisters did at their best. They responded to the unmet needs of their day. So in addition to St. Vincent's, Catholic sisters also established old age homes and hospitals for tuberculosis patients and other discrete populations. At St. Vincent's, they started a palliative care program, a hospice program in the 1970s in response to the needs of cancer patients. When medical care was exhausted, sisters realized that patients still needed somebody to accompany them in those final moments of life. And in some ways, that was a throwback to the founding mission of the hospital. In 1849, when patients came to St. Vincent's, often it was a place to die, and it was simply the sisters providing bedside care for those for whom medical science wasn't able to treat. And so St. Vincent sort of took up that role again in the 1970s and established a really important hospice care program that later translated into caring for AIDS patients during the 1980s.
So many fascinating stories, and of course this took you over a decade to put together. Dr. Rzeznik, thank you so much.
You're welcome. Thank you.